Hey, the sun is out for spring, so I think it'd be a good idea to talk about the A, B, C, D, and E of skin cancer. So this is a little trick that is easy to remember, and it kind of helps you screen for melanoma. You got to be careful. This doesn't tell you 100% of the cases, but it can give you a starting point. If you have any skin lesions, the only way to know what they are is get in for biopsy. Sometimes we can tell by trained eye if it's warranted or not, but definitely have a doctor look things over. If you'd like, make an appointment with us, we'd be happy to take a peek. So melanoma is just one type of skin cancer, and these are some signs, and they're easy to remember, so it's usually a good starting point. A stands for asymmetry. So if you have a mole or skin lesion and you cut it down the middle with a ruler or a line, if the two sides are different, that's usually a concerning sign and may warrant a biopsy. If the borders are irregular, B for borders, that's also a concerning sign. Usually safe moles have smooth borders. C is color. Safe moles usually have one color throughout, and melanomas tend to have multiple colors, or even blues and reds and unusual colors. D is diameter. I think the cutoff is about 6 millimeters or a 1/4 inch. Usually you can use like a pencil eraser as a guideline for that. Anything over that definitely deserves a look at. E is evolving. Lesions that are getting bigger or moles that are getting bigger over time definitely should have a look at. A couple other features that I always look at: if you have multiple moles and one just doesn't look like the rest of them, have someone look at it. A couple other things that aren't included in this: if you have a scab that just won't heal, sometimes a biopsy is warranted. Seen a few of these, and they're squamous cell cancers. That's another type of skin cancer, and those can be pretty aggressive. The other main type of skin cancer is basal cell. These usually look pearly and white, but honestly, all these types of cancer can have multiple appearances. So the bottom line is, if you have a mole or lesion that concerns you, get in for a skin check or biopsy. If you don't know where to begin, either see a dermatologist or us. We'll take a look. A couple other things. For whatever reason, we always say sunlight and UV rays cause skin cancer. They often arise on the soles of the feet and other areas that aren't exposed to the sun, so those areas are important to check too. Try to think what else. Use your sunscreen. I do think that we get some ultraviolet exposure through our lights indoors. They're supposed to be filtered in the US, but we're not entirely sure of the quality control on every single light bulb out there. So sometimes it makes sense. You might want to look into it on your own, but sunscreen, even if you're staying inside, maybe a low, mild SPF one would be beneficial. So yeah, like, comment, subscribe, let me know. We made a video on vitamin D deficiency, which is when the sunlight's dimmer, so check that one out too. I'll try to link it below. Have a good one. Bye-bye.